everyone. Dr. Melanie Kreitz here with 360 Pelvic Health Institute and the Center for Men's and Women's Urology, coming to you again with another segment from Portland, Oregon. And I want to talk to you today about a condition called incomplete bladder emptying, or sometimes known as urinary retention. And what that is a condition where the bladder does not get completely emptied. And I have had a number of patients recently come in with this condition. So I want to address this a little bit, because one of the things that we need to address is being able to get that bladder emptied. And there are a few ways that we can accomplish this. One is a catheter that goes in through the urethra. So for the ladies, through the urethra down by the vagina, and for gentlemen, it would be through the penis, up the urethra, into the bladder. Patients can have a catheter that is what we call chronically indwelling, meaning they keep it all the time. And that just allows the bladder to continuously drain so that the bladder doesn't fill up, causing problems. Another way to get the bladder completely emptied is another indwelling tube. It is a catheter, but it goes in above the pubic bone, and it's called a suprapubic catheter. Sometimes that's much more easy for patients to take care of, for caregivers to take care of, and generally is much more hygienic as far as being able to clean around the area and keep the area dry, to keep the genitals from breaking down from chronic moisture from urine that leaks out in that area. So having said that, the tube, instead of going through the urethra, goes in above the pubic bone. And again, it just can continuously drain the bladder. There's also another way. Rather than having a chronic indwelling tube, there is a technique called self-intermittent catheterization. And that's where the patient or a caregiver inserts the catheter. They're given special instruction of how to insert the catheter in through the urethra to drain the bladder. Once the bladder is drained, then the catheter is removed. And this is done generally on a schedule of every 3 to 4 hours throughout the day, and even perhaps the nighttime. Because when the bladder can't drain, that certainly causes conditions such as swelling of the kidneys or backup of urine into the kidneys. It can precipitate urinary tract infections and bladder stones, not to mention can just be horrendously uncomfortable. You think your bladder is just continuously being distended, so you get more and more full and more uncomfortable. And in extreme circumstances, we've actually seen the bladder rupture because of it. So this is a very common condition. Sometimes the incomplete bladder emptying is caused because the bladder doesn't function properly. Or for ladies, sometimes the bladder drops down and prolapses into the vagina, and urine always sits in the base of the bladder and doesn't completely empty. Sometimes for men, it is because of an enlarged prostate. And one or a combination of these 3 ways to get the bladder emptied may be used. So it's very important to get that bladder emptied. It's also more important to figure out which one of these treatments is the correct one for you and your treatment goals, and what would be best for you if it's needed long-term or short-term. So it's going to be very important for you to discuss this with your doctor to find out which one of these is the best for you. So I hope this helps. I hope it gives you a little bit of information, some things to ponder if you're in this situation, something that you can think about to work with your doctor to formulate the best treatment plan for you. So as always, everyone, thanks for writing in, thanks for asking your questions, and thanks for letting 360 Pelvic Health help restore your confidence.